Okay. Some of the limitations that we found when my mentors formulated their methodology was the participation and compliance of the different individuals we assessed in this survey. Some people might not really want to discuss personal issues such as drug use and alcohol use because it's a very touchy subject. So what my mentors tried to assess and fix that problem was to use some kind of monetary motivation, such as maybe a gift certificate for a new haircut, things of that nature. Other things that might influence some kind of limitation was client satisfaction. Once we have to prod and ask them so many questions, they might be dissatisfied with the method of the survey and they might drop out. And this is also attributed to questions in personal life. And because there is no previous research in this field, we couldn't really gauge an expected result because there isn't really anything to base it upon. Our future applications include creating an effective intervention and reducing the rate of new cases of HIV in Brooklyn and even further beyond. So let's review. I introduced this project as telling you facts about HIV in African Americans, and the CDC called for a proposal. I said that our objectives were interventions and finding out transmission risks and factors that might influence these risks. Our hypothesis, if you can't see, is factors, beliefs, and the effectiveness of our interventions. The methodology that I'm doing right now is the pilot work, and I showed you the proposed timeline if this study gets approved by the internal review board. Limitations were the compliance and the satisfaction, which we tried to fix by influencing them with money. Predictions were the lack of research. Predictions were the lack of research that. Predictions were the lack of research that was previously completed in the field will motivate us to complete and advertise the survey. And the conclusion was that there is a groundbreaking research that we're accomplishing here, and it will benefit many fields of science. And our future insight is to reduce HIV rates. Here are my references. Joseph, who unfortunately couldn't be here today. Ms. Micheline Joseph, who is my liaison at the SUNY Downstate Medical Center. My science research teacher, Professor Janice Baranowski. Dr. Sat, Harlem Children's Society staff. Rodney, who introduced me to the program. Diana Chung, who is working with me at SUNY Downstate, the Arthur Ashe Institute of Urban Health, and my parents, Mr. and Mrs. Joseph Ocran.
Are you conducting the field research right now? Are you literally going to these? Is that where you are with it right now?
Actually, we're going to the fields in the different sites next month. Mm-hmm. What I'm doing this month is just going over different review. I'm reviewing literature and compiling different sources, because I really want to understand the topic, and at the same time, I have a paper to give it to Ms. Baranowski in the fall. So.
Do you have specific locations already targeted to go visit?
Yes.
This place?
Actually, we have 4 different barbershops that we're going to visit in Brooklyn, and we're not limited to that because, as you may know, there is compliance. Exactly. That's where the populations targeted usually congregate. And we have many neighborhood barbershops within these neighborhoods that are willing to comply with the survey.
Wonderful.
Thank you.
In pertaining with the barbershop, how will that actually go about with the intervention? Are you just going to go and ask people questions, or are the barbers going to ask questions, and how are you going to approach that?
Okay. First, we're going to approach different barbershop, like the owners of the barbershops, and ask them if it's okay if we can use the barbershop as a place of study. If they comply with that, then we'll have the focus groups amongst the barbershop owners and the different patrons of these barbershops. And from there, we can assess the different things to change an intervention that we came up with or develop our intervention in the first place. Did that answer your question?
Yeah.
All right. Any other questions? Ms. Baranowski?
Do you have an age group that you are targeting?
Yes, we're targeting males of the ages between 18 and 45. Sorry, we have a couple more questions. Young lady.
Why are you only targeting males?
Okay.
What about the females? No offense.
Of course. Okay. We're targeting males because African American males have been found in some of the research, the review of literature that I found. Some African American males are very, how do you say, it's called machismo, where they don't really want to comply with HIV prevention. They have certain myths about HIV that they think it will never affect them, that they're impervious to it, that because they're not homosexual or they don't engage in activity with other races, that the disease will never get to them. But in fact, they do. So we wanted to attack that population because the female population is more receptive to listening to different interventions than the male population.
What about the Hispanics and stuff?
I understand what you're saying, and this research could be expanded to different populations. But because African Americans have the highest rates of HIV infection in Brooklyn, New York City, and the United States, we felt that we had to affect them first. We had to finish that problem first before we can expand on other populations. So, thank you very much. It was a pleasure.